we will go on to our next speaker, Renata Meyers. So Renata Meyers has a Master's of International Public Health. I had to look up that acronym, MIPH, and a registered nurse. And she's been working on adaptation and public health consultant with 15 or more years in infectious disease expertise as a public health nurse and researcher across Canada and internationally. She's WHO certified epidemic manager, sessional lecturer, part of the MicoVac project and the JitsuVax project, which I Googled yesterday, which was fun to learn something about. And she's also the founder of Adaptable Folks. So her talk is Navigating the Dichotomy, Unveiling the Paradox of Planetary Health and the Commercial Determinants of Health in a Digital Information Age. Renata.
Thank you for having me. Thank you for the organizations for creating this incredible conference. And I'm just going to jump right to the goal, why I'm here. And it's in that image, the involve. So I'm actually here to take all the other presentations that have been mentioned today and try to focus on how do we build trust. Okay, so I really appreciate all the previous presenters, and you might even see some of the slides from your presentation. So my name is Renata. I'm an Eastern European settler, a refugee from Romania, and an immigrant from Hungary. And I am living in a place now called Guelph, Ontario, Canada. It is the traditional land of the Anishinaabe, Attawandarok, and Haudenosaunee peoples, and a Treaty 3, 1792, lands of the Mississauga of the Credit. And there we go. And so my declaration is I wear multiple hats. Today I'm here representing Adaptable Folk as the founder, public health and adaptation consultant. And I have to acknowledge the global infodemic management community. They're in my WhatsApp. So at any given time, if I have a question, they're the people I go to. So my knowledge and biases also come from the knowledge that we share. And so when I teach nurses and beyond, I always try to get them to, while identifying a problem, start mapping out the elephant. So this is borrowing from complexity science. And it's important to not just look at the problems, but also recognize that the problem looks different from different perspectives. So wherever people sort of enter or look into a system, that's how they understand it. So I really like this elephant model. And so when you identify the processes that the problems sort of occur within, you start to identify leverage points where you could build trust. And by building trust, you could also build collaborations and relationships to solve those. And so Enrique used this planetary health model. I borrowed it from Planetary Health Alliance, and it's Meyers' 2017 framework, where it talks about sort of the various factors that play into how planet impacts human and flora fauna health. And so I want to highlight that it's not just a dichotomy that we're dealing with, so the planetary health versus the commercial determinants of health when we start talking about consumerism, but also what influences our behavior is the information that we consume. So there's that digital information age or the information environment. So I was sort of being cheeky by calling it a dichotomy because, of course, it's more complex than that. So from the Global Risk Report that came out January 2024, you can see that how people sort of evaluate risk based on severity. Mis and disinformation is the top problem in the next 2 years. And then if you shift to what are our risk and problems for the next 10 years, it goes, mis and disinformation falls down to fifth. However, I'd argue that 1 to 4 directly impacted by how the polluted information environment sort of disrupts social cohesion and for us to act. And so don't read this, just take a picture. But this textbook is one of the best things to read as an up and coming health professional, public service professional, or scientist to understand how the commercial determinants, or particularly transnational corporations, influence government action and public health response. And so as a public health professional, I don't know if we're teaching our up and coming leaders that a transnational corporation can actually sue governments if the public health programming interferes with corporate interest, which is called profits. Okay, so we need to look at, so the textbook actually goes through, the food industry, the tobacco industry, but through the fossil fuel industry and the issues around manufactured doubt. And it also goes on to talking about building skills, but this manufactured doubt is what I want you to focus on. And so we saw this play out during the pandemic, okay? Dr. Tedros Ghebreyesus announced that we're not just dealing with a virus spread, we are dealing with an infodemic. And so how do we protect our people, even our healthcare providers who were questioning some of those, government public health driven mandates? And so the infodemic management community and team delivered fast and furious training to upskill, like myself and almost 1,400 folks across 140 countries, and published a text that's open access. So it's open access because it allows transdisciplinary professionals to upskill into a modern life, okay? And so here is going beyond that health communication, addressing social and behavioral science, participatory, human-centered, digital health from a whole of society approach and a whole of information ecosystem approach. And so if you haven't heard the term infodemic, it just means that there's an overabundance of information, good, bad, ugly, the mis and the disinformation that surges during an acute health event. But we can argue now that we are living in a polluted information environment. And so how do we address that? How do we navigate that is important? And isolated vulnerable populations are particularly susceptible to this. And so we need to understand what this new information environment is, which is both in the physical space as well as the virtual space. So our old public health approaches, right, we need to take a look at them. We need to maybe unlearn some things and relearn some of the more modern approaches in those divided worlds. And so here's an example of a noisy, polluted information environment. So here's a perfect study looking at pro-environmental behaviors, which is encouraging people to touch nature, feel nature, be in nature, right? And it also improves overall health. And then you look at, what are some of the noisy information out there is, well, the ticks are hungry and carry Lyme disease. Then we've got mosquitoes with West Nile, and there's also coyotes. And if the wildlife doesn't get you, then the wildfires will diminish your your quality of air. And if the wildfires don't get you, then, well, there's a heat warning. And so, which happened, coast to coast last year. And just to show you that it's not just the heat that's a problem, frigid temperatures, interact with your electronic vehicle batteries. So it's just to show you that how do we expect new evidence and recommend people to get outside when this is the information environment that we exist in. Now, I know we're shortly out of time, so I'll try to speed up here. But during the pandemic, we saw that there is an impact on morbidity and mortality. So misinformation kills. And it interrupts recommendations. It disrupts trust and previous trust that we've had with populations. It hinders accomplishments. It creates, stigma, us versus them, and most importantly, undermines social cohesion. And this is where, the rise of the loneliness epidemic is being talked about. The US CDC announced. And so, how do we protect our planet if we can't speak the same language and come together? And so this is a crucial issue to address. And so here's an activity that I wanted to do, but I can't see my audience. So when you come across sort of that noisy, polluted information, what's your initial response? What's your knee-jerk reaction? Do you state the facts and, we have a climate crisis? Or do you say, well, that's wrong, and let me tell you the right thing? Or there's a new approach or newer approach that shows promise, which is pre-bunking, which is actually showing individuals the tactics used to create this doubt, right? The doubt that I was speaking about earlier. And so here's another incredible example on motivating action, right? And this is how doomerism and negative emotions on the social media spreads beautifully. So if you want to collect likes, if you want to be the most popular online, that's fantastic. But it actually creates paralysis for action. Okay. And so motivation for positive climate action comes from framing messages on what people value and what they care about. And you probably are aware of this. So I'll just keep going here and recognizing that misinformation impacts all levels of society. So yes, while we have hammers and we have old ways of doing public health, we do need to develop new tools. And this is what the WHO infodemic management team has done while the pandemic was happening, is deliver a transdisciplinary competency framework. And this is not about addition, like we have all the nursing competencies and there's competencies within the applied sciences, but this is actually embedding it into current available training competencies for our learners. So it's teaching social listening online and offline and answering the questions and concerns that people have. And it's countering mis and disinformation that benefits society. And so, again, I'm trying to get everyone to zoom out because we also need to recognize that just by replacing one energy source with another energy source is still stabilizing the imperial mode of living. Okay, so we need to recognize that who are the political actors, the social and the economic drivers of our processes, and also the persuasions and the coercions where the commercial determinants of health comes in. And so I love this quote by Alvin Toffler that says, the illiterate of the 21st century will not be those who cannot read and write, but those who cannot learn, unlearn, and relearn. And I think that's very important. So if you don't yet understand the polluted information environment, then this is a really great article to read further. And so I promised I started with my goal and we will end there, which is how do we build trust? How do we build trust in our healthcare providers? How do we build trust in our public? And how do we rebuild and maintain trust while we all work towards, healthier planets? And secondly is how do we build shared leadership structures where the final decision rests within the communities? And so what is your smallest unit of action after hearing me ramble on? So what are you unlearning or relearning today? And I provide you with some resources that are open access. I'm open to connect and build more trainings and projects as you see fit. And again, I give you an example of what I built with the Canadian Public Health Association and CanVax around embedding infodemic management competencies in a Canadian vaccine programming. So it's from policy to frontline and transdisciplinary. And I adapted that from the global comprehensive training that was led by Gavi, UNICEF, USCDC, and UNICEF. And so thank you for your time. I cannot see you. I'm so sorry. Maybe once I stop sharing. And I just wanted to sneak in one more slide for the nurses in the crowd, as I'm sure you know best practice to medicine administration, which comes with, a set of rights, the right med, the right dose, the right time, da-da-da. And so this is Dr. Barbara Reynolds from the CDC CERC, who said that the right message at the right time from the right person can save lives. And so how do we understand our communities? And so I offer you some tools, whether you use story narrative analysis, whether you use online and offline insight reports, or you use the US CDC's rapid community assessment to understand people's questions and concerns. And that's all I have for today.
All right. Thank you very much, Renata.
Just real quickly, one of the things that I would just amplify from your talk is the value of values-based messaging for different groups of people. And I've argued for a lot of years that that's something that we get very poor at. We assume one message fits all, but it doesn't any place. And so I value that for including it into your work. Just a comment.
Thank you so
Okay,
and I actually
thank you.
did have a video just to demonstrate what a psychological inoculation is, but you can just Google inoculation science and they have some really good how to pre-bunk and learn about the tactics used.
All right, let's thank Renata once again.